Hey, Med School Made Easy. Today we're going to be talking about maintenance fluids. This is for your patient who's in the hospital and is NPO or can't drink or intubated, and you need to rehydrate them with maintenance fluids to prevent dehydration. This is not for your bolus resuscitation, but rather for what you're going to give them every hour. Because that we're talking about hourly fluid needs, and we're using the mnemonic 4, 2, 1. This is opposed to the daily fluid needs, which would be 150, 20. You might hear some people talk about that, but I don't think it's very clinically useful because we're not, we usually don't write orders for days. We write them for every hour you give this much fluid. So we're going to do this hourly 4-2-1 rule, and we're going to do an example to teach this. So let's say we have a 100 kilogram individual, which is pretty typical, but it's also easy math, more importantly. And what this means is for the first 10 kilograms, they're going to get that times 4, so 40. For the second 10 kilograms, they're going to get those 10 times 2, which is 20, and then this is the rest. Okay? So 4, 2, 1, first 10, second 10, rest. So with our 100 kilogram individual, the first 10 is going to be 40, so write that down, and that takes us down to 90 remaining kilograms that need water, or need fluid, right? The second 10 are going to be 20, so now we're down to 80 kilograms left. So 80 times 1 is 80. You add these up, you're at 140. So a 100 kilogram individual needs roughly 100 cc's per hour of your isotonic crystalloid du jour, your lactated ringers, normal saline, plasma light, whatever you got. This works really well, right? You can easily calculate this up, but there's an even quicker way to do that. Let me show you how that's done. So for our 100 kilogram individual, let's say we didn't do this 4-2-1 rule, and instead we just did the 1 rule. It'd be 100 times 1 is 100 cc's an hour. Now it's different than the 140 we had earlier. How much different is that? 40. Okay, so basically what you can do is take their weight in kilograms and add 40 to it. Let's say you don't believe me, right? You're like, you just made that way too easy. That's impossible. I just take someone's weight in kilograms and add 40 to it, and that's the hourly maintenance rate. So let me show you with a different example. So we're going to do the 4-2-1. By the quick method, let's do a, I think 80 should be pretty easy math. So this is an 80 kilogram individual, okay? The quick method is their weight, so 80 plus 40, and that equals 120 cc's per hour. All I did is I took their weight, added 40 to it, and that's how many cc's you need. Now how does that work? Let's check it the other way. The first 10 would be 40, the second 10 would be 20, and the remaining there would be 60. 60 plus 60 equals 120. So you don't even need to calculate it all out or doing multiplication. Just take their weight and add 40 to it. The reason why that works is because if you look at the difference, greater than 1, if you're interested, greater than 1 is, so 2 minus 1 is 1, 4 minus 1 is 3. And so if you're taking these numbers, which is 4, and you times it by 10, that's where you get the 40 from. So there's, makes sense. So in other words, the 4-2-1 rule, or just take their weight and add 40 to it. All right, that's maintenance fluids. Thanks.